Hi, good evening, everyone. This is Adrian here. Very excited to have all of you here with us tonight, especially at our MindMatters Masterclass. And tonight is a very special one because we are having our guest speaker to talk about EMDR, which is a very powerful tool for trauma treatment. And I can't wait to share more with all of you about that. So I'm going to introduce our guest speaker tonight, Peter. He's a very highly experienced clinical hypnotherapist, integrative psychotherapist, and also an educator at heart. He's now serving as the Director of Studies at the London College of Clinical Hypnosis. Peter specializes in trauma-informed work, pain management, and most importantly, the mind-body connection. He has developed and led hypnotherapy as well as psychotherapy training programs internationally. So we are very excited to have him here. So without further ado, please join me to give him a big warm welcome to Peter.
A big welcome to every one of you. So one thing I kind of like to ask, those of you already working with clients, you noticed that sometimes clients improve on their therapy journey whilst others, despite your best efforts, remain stuck. I certainly relate to this as a practitioner. And this is a question that EMDR seeks to answer. And that is, what are we missing that is keeping our clients stuck whilst others move on? Now, when Francine Shapiro first developed her trauma protocols, Francine Shapiro developed this concept of EMDR. She was looking at essentially four components: the nature of trauma, how it's stored in the brain, the way the brain processes these experiences, and the mechanisms that work at a very deep neurological level and at a level of experience and memory. So there was a lot that she was looking at. In a moment, we're going to look at the 8-phase EMDR model. It's a very structured model that EMDR has, and that is based around this thing called the AIP, or the Adaptive Information Processing model that we use within EMDR. And we're going to explore phases. We're going to explore the AIP very, very shortly. Suffice to say that there is an overwhelmingly large amount of really good research that shows EMDR's efficacy and how effective it is, which is why it's so popular with mental health care authorities on a global basis. And it's also worth noting too that it also works with what we would call implicit and abstract areas of the brain that perhaps other therapies don't connect with. So there's a lot supporting EMDR. And the modern reality of therapy today highlights that there is a clinical gap. Now, globally, there's about 60 to 70% of people who are likely to experience at least one potentially traumatic event in their lifetime. I'm sure this is resonating to each and every one of you, as it is again to me. But this doesn't mean to say, and that's important to remember, a traumatic event doesn't mean to say that these people will develop post-traumatic stress disorder. Luckily for us and luckily for the world, that remains to round about 4 to 6% of the population. But what it does mean is that you and I, and as friends of people and colleagues of people, we're going to be seeing more and more people, certainly in my consulting room, in our consulting rooms, that are presenting with trauma-like symptoms. And I not have trauma, but they will present with trauma-like symptoms. And knowing how to provide trauma-informed care is becoming, I would argue, is an essential part of our everyday work as therapists. Now, many of the clients we work with using the excellent talk therapies or other therapies that we are trained in or are training in, they do gain insight in that therapy journey. They gain insight, they understand what's going on, and thankfully, they gain resolution to their particular issue that they're presenting with. But I think, as we're all aware, there are times when some clients remain resolutely stuck. And part of the reason for this is the way that trauma-type experiences are encoded in the memory, in our memories. And it's encoded in a way that's very fractured, very disconnected. It's not just one sort of blob of, oh, that's experience. The experience fractures, stored away in little bits within our mind, but they are not connected together. Let me give you an example of this and how it can create issues for clients, for us as humans. Now, I'm a clinical supervisor. I carry out plenty of clinical supervision sessions, and I was guiding somebody through a supervision session with me, and we were discussing what, on the surface, appeared to be a very, very straightforward weight management issue. One of those things you see then, oh, right, nice and easy, straightforward. Never think that. As therapy developed, my supervisee said their client was becoming quite inexplicably agitated. They were showing resistance to treatment. And she said that at one session, her client suddenly just exploded shouting, "I need to stay fat and ugly to stay safe." Well, my poor supervisee was quite taken aback about this. And then she disclosed that she needed to have the extra weight to stop being sexually abused by her brother. Now, insight came, but in the next session, she presented and she had no memory of the outburst. And she still seemed resistant to any further work that was going to or was being proposed. So, with the agitation, noticing the resistance, thinking about the emotional outburst, and importantly, the subsequent amnesia for all of that, that led me to recommend to my supervisee that her client was sent to a trauma therapist trained in EMDR to work through this. And she dutifully referred her client on. Once the EMDR work had occurred, he came back to my supervisee and addressed the weight management issue, and very rapidly that issue was successfully resolved. And this is where EMDR comes into its own. It's the approach that really bridges the gap between insight, understanding, and resolution. Things are okay. It bridges the divide. If you remember, I say when we experience some traumatic experiences, it experience fractures in the brain, it becomes disconnected. EMDR bridges that divide between these fragmented, fractured parts of the traumatized or the traumatic experience. Now, mentioned before, EMDR is based around the AIP model, the Adaptive Information Processing model. And basically that explains how our brains naturally process any type of experience, challenging, pleasurable, whatever it might be, basically processes it through to a healthy and what we would call an adaptive resolution. It's a very important survival function. If we didn't have this, quite simply, our species would never have survived. We wouldn't be talking together like this, but luckily we had the AIP. And what happens? There's a natural processing of events. Your boss is horrible to you on Monday. You start thinking about it. You get angry about it. You start talking about it with your friends. You might dream about it. And by the end of the week, you're feeling okay about it. It's just something that your boss did on Monday. And that's a natural processing. When trauma or highly emotional experience is presented to us, for some people, this overloads the brain. It disrupts this natural processing that we're talking about here. And instead of being processed, the overload shatters the experience. It's still there, we're still aware we had it, but it shatters and hides it in various different parts of the mind. And sometimes talk therapy works really well, and sometimes talk therapy, as superb as it is, doesn't quite reach these disconnected fragments. I think, I can deal with this bit over here. Meanwhile, this bit over here is still having a negative influence on them. And EMDR has a number of approaches that we use when we're applying it, based on what we call bilateral stimulation. We stimulate the left and the right-hand sides of the mind, of the brain. Typically, in EMDR, eye movement, desensitization and reprocessing. Typically and historically, we've used eye movements with this. So, for example, I might ask my client to focus their attention tip of my fingers, and no matter where my fingers move, keeping their head level and without moving their head, follow my fingers with their eyes. So, carrying out these movements, the client is looking left and right as I'm doing this. Left and right stimulates the two hemispheres of the brain. Very historically traditional way of doing eye movements or EMDR. But we can also bring in other approaches, auditory approaches, hearing. We can click in the ears of our client as they're processing, or we can use touch, feelings-based. Back in the day, it used to be that the therapist would touch the back of the client's hands. Well, we understand a little bit more about the ins and outs and the rights and wrongs of touching. We now have an approach, talk a little bit more about this shortly, called the butterfly hub, where we ask the client to sit like this, their fingers touching their collarbones, and just tap. Which, to be fair, a lot of clients say is very comforting, and many of my clients say it was a really lovely containing feeling that they have. Now, EMDR, it's a model, it's an idea, it's based around 8 phases, 8 large steps, which we'll look at in a moment. And working through these 8 phases, this is what helps stimulate the adaptive information processing model. So what it does, the 8 phases help the AIP to open up and unblocks that processing. The fragmented memories start to come together and are processed through safely, comfortably, to a good resolution. And then the idea of what I mean, taking you through a case of mine from a little while ago. I had a client who presented with a lack of self-worth. She presented for hypnotherapy, which is my prime therapy discipline, but I'm also a trained EMDR practitioner, been doing this since the late 1990s. So she presented with this lack of self-worth. We agreed we would probably want to be using EMDR. And she said this lack of self-worth came from having witnessed, when she was very young, both her and her sister were very young, witnessing her sister being very, very badly scalded by boiling water. Now, it wasn't her fault, and there were witnesses there at the time. She was on the other side of the room. So it really wasn't her fault. It was just a horrible accident. But she couldn't escape the feeling of being to blame for this. And that was what was holding her back. And, we decided EMDR would be the great way to work with this. I was working virtually, so we were using the butterfly hug as part of this. And what we did was we identified the most disturbing image of the event, which for her was her sister screaming as the boiling water seared her skin. At the same time, we identified a negative belief that she held about herself. And her negative belief was, I'm a terrible sister for letting this happen. And at the same time, and I'll explain why this is important as well shortly, we identified, when she thought about that image of her sister being scalded the boiling water, where she felt that in her body. She felt in her chest. And using the butterfly hug, the EMDR protocols, the 8 phases, we successfully processed the image, we processed the belief, we processed this body sensation. But during processing, something really interesting emerged, which she wasn't expecting. As a therapist, I always expect the unexpected. But she suddenly remembered that there was an early attachment issue, an attachment trauma that involved her father. And I think one of the things that we should all be aware of when we're thinking about trauma processing, or when we're thinking about trauma, is sometimes newer traumas overlay much older and deeper traumas. I like to think of EMDR as being a bit like peeling away layers of an onion until you get to the very deep element. And once you get there, trauma starts to really resolve itself. So EMDR it has very specific steps that we guide our clients through, but it's not just about following them. We also need to be able to understand the process our client is going through. And that's a very important part of any training. It's not the A, B, C, D, E, F, G steps you go through easy talk, but it's the processing that one has to also understand. And just a little aside before we go on, just saying, the butterfly hug itself was developed to treat groups of adults, groups of children, following the devastation that was wrought by Hurricane Pauline that hit Acapulco in Mexico in 1998. And it might be interesting to see, if you all have a little bit of practical experience, if you want, of what this butterfly hug is. So I ask my clients, and you can all do this if you want, ask my clients to have their hands like that. I get them to link the thumbs together. So you've got the thumbs linked together. It's like the head of the butterfly. The hands are like the wings of a butterfly. And we ask them to place their hands there, just so the tips of their fingers are tapping on their collarbone. And, if you want to, have a little go with this. You're just doing quite a rapid tapping, very light tapping, gentle tapping. And the reason I'm kind of saying this to you is nice like a takeaway for you from what we're doing today. You can stop this if you want. Now we can carry on. But what we're doing here is with doing that tapping. That is not EMDR. EMDR is about the process. It's just one thing we do within EMDR. But that tapping, that left-right tapping, we do like this. It helps to reduce anxiety. Likewise, without having to follow someone's fingers when you're doing the eye movements, horizontal eye movements help reduce anxiety. So those of you working with clients who become a bit anxious, get them to just do a bit of tapping or horizontal eye movements. And also, for your own use, it works, I use it. You can use it on yourself to help reduce anxiety on anything you're going to be doing. So it's something that, just try it for yourselves, try it with your clients if they're anxious. You're not going to go into a full EMDR processing with many steps within that. But as I say, it's a nice way of helping reduce anxiety in any event. And so I'm talking about the procedure and everything else. Let's look at the 8-phase EMDR protocol that we're working with. There are very distinct 8 phases that we go through. It's 1 through to 8, but it is structured. And let's challenge a myth that's often out there. EMDR is fantastic as it is. Lots of people think, one session of EMDR and everything will be okay. Well, we need to have a little bit of a reality check there, because it does take several sessions with EMDR, and EMDR is not the be-all and end-all. When I'm working with a client, I use my other therapy skills, hypnotherapy or EBT, whatever it might be. I'm I've agreed to work with my client. Then I bring the EMDR in for the trauma processing. After EMDR, I continue with something else to help ensure the closure and everything is okay with my client. What I'm saying here is it takes place over several sessions, but it also integrates really nicely with other therapists, therapists that you and I are practicing, therapies that you and I may yet to be trained in. So the 8 phases. Phase 1, history taking, a very common experience through all therapies, the case history. We all need to take a case. Phase 2 is about basically preparing your client. What we're doing is we're stabilizing our client for the EMDR journey that they're going to go through. What we're looking at is helping to connect them with emotional and cognitive resources that support them through the actual trauma processing. I've said it before, I'll say it again. Processing with EMDR can be a very pleasant, but it can be a gentle and empowering experience. We're not having to ask the client to face up to anything horrible that's going to further traumatize them. So that's what preparation is about. Resources, cognitive strengths to help them through that journey. Phase 3 is the assessment. Basically, what we're doing is we're working with the history taking. We are working with our clients to essentially identify appropriate, what in EMDR is termed as either a target or a node, depending on what literature you're looking at. But basically, the target, the node, it's the door we use to open up the AIP thing to focus on that lets us into that journey of processing. So in my client's case that I referred to earlier, her main node, was the image of her sister screaming as the boiling water seared her skin. That was the door into processing. Then we move on to phase 4, which is desensitization. And what we're doing here, this is where the trauma work really starts. We've got the bits and pieces we need. So we're using eye movements, we're using butterfly hug, auditory stimuli, whatever it might be, essentially to reduce the emotional intensity that's associated with the memory of the trauma or the upset. The emotions keeping it up there. We've got things like beliefs and body feelings keeping it up there. Reduce the emotion first. That's what the desensitization is all about. Phase 5 is what's known as installation. This is where we take a negative belief that's contributing to keeping that trauma in place. In my client's case, her negative belief was, I am a terrible sister for letting this happen. And what we do is we look at that, we find an agreed realistic and healthy positive belief, and using eye movements, butterfly hug, auditory stimuli, we install this agreed positive belief. So by installing that, we take away the intensity and the validity of the negative belief, and that strips away yet another support and trauma in place. Phase 6 is the body scan. Basically, we know that the human body can store trauma in it. It's somatic memory. The body remembers. So that somatic memory, what we're doing in EMDR is recognizing it, and we're processing that memory. We get the client, in the client's case, it's a feeling in her chest, to focus on that feeling, and we process that out. Once you've gone through these, we can then move into phase 7, which is closure. Closure is not the end, got phase 8 coming up, but closure. And closure is all about ensuring that processing has been effective, our client has achieved the resolution that they're looking for. In effect, that they can view their past, their present, and their future without disturbance coming to them from the traumatic event that we've been processing. A lot of people think, oh, that's it, no more work to be done. No, mind is a very fickle thing. We have to go into phase 8, which is reevaluation. What we're doing is on subsequent sessions, we might be doing other work from whatever other disciplines we practice. Therapy work or ego state work or whatever I might be doing. I'm checking that nothing else, traumatic or otherwise, has bubbled up to the surface. Sometimes bits of trauma get hidden, and occasionally through the processing they'll bubble up when you think everything's gone. And if they're there, we need to pay attention to them and process them out. So yes, the EMDR is relatively rapid considering what we're dealing with. Very effective. Research is it so. But we've got these essential stages that we need to be guiding our clients through for a very careful, very compassionate journey of releasing themselves from the trauma. Wonderful stuff, but we need to be realistic. We need to understand, like any therapy approach that we practice, it doesn't always work, and it's rarely an issue with the method itself. Of course, certain people don't relate to certain therapies, and we have to understand that. But what we tend to find when EMDR doesn't work the way we're hoping it will, we've got 4 areas that we could be looking at. So the first one is the case formulation. If that's not clear, if that's not fully understood, and those of us as practicing therapists, we know and we understand that getting a good, accurate case history is the bedrock of any therapy. Second is that for whatever reason, the wrong nodes, wrong targets were selected during this case formulation. There's no hard and fast rule of what to pick. Be around what your client is wanting to focus on to begin with. Sometimes the nodes are incorrect. In effect, we are opening the wrong doors and we're going in that direction when actually processing, we should be going in that direction. Thirdly, might be is inadequate preparation of our clients. Basically, if the client doesn't have the resources, the cognitive understanding, they won't be able to engage with the process of EMDR. And instead of opening up the processing in the AIP, it can further block it, unfortunately. Sometimes, I want to say that badly trained therapists use EMDR without thinking. They like to say, I've got this technique, and push the clients through a very rigid A, B, C, D, E, F, G type of process. And yes, there is a lot of steps within EMDR. When I first sort of looked at EMDR, I was like, oh my goodness, that's complex. There are a lot of steps, but there is a very logical rhythm to them. So one of the things that when you train in EMDR, you'll see this flow. But badly trained people don't necessarily see the flow and don't understand that the protocols, the ones we'll teach you, the protocols they're using, they are designed to be adapted for the needs of the client as they travel through their therapy journey. So you don't rigidly stick to the steps. If the client's needs are such, you can jump over a step and then return to it later. You can do something else, finish at a different point. Or things that we will train people to understand and what to do. But for properly trained, properly equipped therapists, EMDR works superbly with the 4 to 6% of the population who have it with PTSD. The statistics show it. World Health Organization and others are very pro its use. And also the thing to remember, yes, EMDR is originally developed by Francine Shapiro to work with war, people who've got war neurosis, PTSD, but it works amazingly well with all trauma-like symptoms that are coming in for treatment. What I mean is people who are presenting with symptoms that have a very high emotional content to them. Not necessarily trauma, but also on top of that, it's not just about that. There are now protocols where we can work with a client who has become stuck in their processing. We've all experienced perhaps the frustration of working with a client who's got a phobia. They really want to eradicate it, but for one reason or another, the phobia is just it's stuck. It won't move. Or perhaps the smoker who is desperate to give up, really motivated to give up, but it just doesn't work. Or maybe someone presenting with issues around eating that, despite our best professional efforts, just maintained. They don't move. And we teach a wide variety of protocols that encompasses what I just mentioned, but we also look at other things like performance anxiety. In the trauma world, complex PTSD or CPTSD is on the increase. Unresolved grief issues, relationship issues, panic disorder, and so it goes on. And it's not just about the upset. It's not just about the negatives. We teach some excellent protocols for helping with well-being. General, feel-good factors. General getting in contact with some very positive emotional and cognitive states to enhance performance, and so on. So EMDR is a very wonderfully, amazingly adaptable process procedure. And when we know what we're doing, it really, really is there providing a bridge where the gaps between insight and resolution occur. It integrates superbly into whatever therapy disciplines that each and every one of us practice. To be quite honest with you, my prime therapy discipline is clinical hypnotherapy, but I can't imagine not having EMDR in my therapy toolkit. So, yes, I'm very passionate about it. I've been practicing since 1998, 1999. And I've seen the process, the protocol evolve to something pretty amazing.
This is where I'm very excited to talk to you about our specialist certificate in EMDR. It is our launch, and we are the Singapore partner with LCCH to offer this specialist cert. It's very powerful because it can bring about rapid results for some individuals, also used across all ages. And it doesn't look at IQ nor the verbalization skills because of the method and the science behind it.
Our EMDR training is designed to give you a very strong clinical foundation in this very powerful technique, whilst at the same time remaining a practical and accessible training for working professionals. So to give you an idea, the program includes a 1-hour introduction session. So we set the scene, 32 hours of lectures. A lot of the lectures are not really lectures, they're actually you practicing. Practice is supervised and we give feedback. A couple of tutorial sessions that we ask you to do and a final MCQ evaluation at the end. Now, through this training, you will certainly gain a very structured understanding of how EMDR works, how it can be applied effectively in many different clinical settings. We also have protocols for pain management with EMDR. By the end of the course, you'll certainly be able to understand the mechanisms behind trauma processing. You'll understand the mechanisms by which EMDR supports the brain in helping resolve a wide variety of distressing memories. And you'll be able to adaptively apply the very structured EMDR protocols in a very, very safe, very professional therapeutic environment. We teach you the structure. Very important. Have the structure. Once you've got that, you can then know how to adapt and work safely with. You'll be learning how to work more effectively with trauma, with anxiety, with any type of emotional stressing experiences. And very importantly, you'll be able to integrate these techniques into your existing therapeutic work, or just be out there practicing as an EMDR practitioner. And you can see from here, we've established collaborations and are still continuing to establish collaborations with professional societies, with communities from within Singapore, with Malaysia, UK, across the world. We've got some very exciting stuff that we're working even in the United States. So we'd like to connect our therapists with the world. After all, we live in a global village.
This is really a global recognized credential. Like what Peter said, LCCH and the partners internationally recognized. So if you get a certificate with us, you can practice literally from all over the world. And it's not only that, it's a fully online class. So it's really flexible. It's great for working adults. So there's really no disruption to your work and you can simply complete this certification within 3 months at a flexible pace, adding to your toolkit of helping others. We don't compromise on supervised practice. In fact, Peter will agree that they are very rigorous in their clinical supervision and practice. So there will be assessment, there will also be case discussion and contact time with the lecturer to ensure that you are able to turn theory into practice. And that's our commitment to the students. The fourth point is about learning alongside with fellow practitioners in this whole journey. And lastly, there's also, membership. So if you're on the course and you graduate, you can actually get registered membership with LACHIP. So these are just some of the reasons to consider, and you can check and get the details more through the web link. And if you're not sure, just get to call with the team and they'll be able to assist you.